I think that you got to remember that there's various stages of the dentition development, and there are various specialists that deal with that. In orthodontics, unfortunately, orthodontics is kind of pegged at seeing kids from 7 or 8, not much earlier. Another specialty of dentistry is pedodontics. The pedodontist will see a child from 2 really on until they're teenagers. So you have various specialties that will deal with kids at certain ages. As far as orthodontics goes, when you're talking about a very, very preschool child that would be from, say, age 2 to the kindergarten or first grade, there really isn't much that we can do to help with a problem other than try and educate the parents some of the things that are very important. Some of the things that are very important that an orthodontist can't control, but somebody else can, is the child mouth breathing, for one thing. That's a problem early on. A child is snoring. That's a problem early on that can be addressed. Are the tonsils in it? Are we having a lot of ear infections or throat infections? That has to do with how a child is going to develop. And those are people, the ear, nose, and throat physicians can deal with that. So the earaches, the tonsils and adenoid infections, the inflammations that they have, all of that is going to affect how the face is going to develop later on. So these are things that do need to be addressed. There are myofunctional therapists that, let's talk about that, with the infant. Some of the problems will start with an infant that can't nurse. They can't nurse because they're tongue-tied. That has to be released. So a child that can't nurse correctly, they're not going to develop correctly. So that can be taken care of. The other things that as a child learns to speak, that's early. That speech problems can be addressed early because we see speech impediments early on developing. That's going to affect the facial development. So there are specialties, and the medical dental community, before orthodontics is really engaged, can really do a lot. Obviously, school teachers can do a lot. Nursery school and need to be advised on what to look for with kids that are in distress, particularly those that can't breathe well, that are inflamed. I mean, so I think the bases are covered with the preschool child that the orthodontist is really not engaged in. I think we can give advice that way, but as far as treatment, we're pretty well limited. Now, as we go forward, the orthodontic community basically is involved with kids from 7 to 8. There's a reason for that. The reason for that is that's when the adult teeth are starting to erupt. Your permanent lower incisors are really coming in about 6, and thereafter from 6 to 7, you're getting the upper permanent incisors in. The problem starts right there. Do you have room for the permanent teeth to come in? So the reason for early treatment is right there. There are issues that the kids cannot get the permanent teeth that are supposed to be coming in, and therefore the intervention starts there. So that's why 6 and 7 and 8 are important in orthodontics, is because the permanent teeth are, you're transitioning out of the primary teeth into the permanent teeth. And every permanent tooth that comes in, it's got to have room. So, and it's best to have the room there before it's needed, So, so that takes care of that. Then the other side of the coin is when all the permanent teeth are in. That's also a great time to finish the treatment and get things totally right. So you got stages, and everything is case specific. You don't have any choice. Sometimes you get the patient is an adult and has not had any advantage of any kind of early. So you have to take it as it is and deal with it. And there's always a good solution, even though some things are more difficult than others. There's always a way to improve and get better. Always a way to get better. All right.